Here's a question for everybody. PTSD and moral injury seem to be the cost of war for veterans who return home. What are treatments for this? What works? What doesn't? And is it normal to return home affected? Who wants to go first? Let's start with one. Okay, Charles Hoge, go ahead.
It is perfect. Well, I think we all know that it's perfectly normal for one to return home from a war zone affected. I mean, you can't deploy to a war zone and not be affected. And the degree of how people are affected, that people are affected in various ways. I like to talk about PTSD, sort of the paradox of PTSD, where a lot of times when folks come home, they come into the medical system and they start getting, labeled with diagnoses, and they have reactivity that's related to the war zone, and they do need treatment very often. But the same things that we in the medical community label symptoms of a diagnosis like PTSD are also the very same, reactions that were beneficial for survival and beneficial for being effective in the combat environment. So there's sort of a paradox there. And a lot of times folks might be, PTSD exists on this whole spectrum, where, and people may be very functional in one area, not in another. So for instance, a lot of combat veterans might be having, struggling when they get home with their relationships or their family functioning, but they're still, highly proficient at what they do, and their team members, if they're still on active duty, their team members and their leaders still want them on their team downrange. So there's that kind of paradox where you might have still very high functioning in one area and lower functioning in another. Anyway, I'm kind of rambling a bit, but that's a...
Yeah, and just to piggyback off of what he said, it's to put it in more like realist, like this is what happened. It's like when you're in the war zone and you're not sleeping because you have guard duty to wake you up in an hour, or you have to be awake. You're hypervigilant on a convoy because you have to stay alive and keep your buddies alive. And then I fly back to Germany and I'm medically evacuated, and all of a sudden now all those symptoms are a disorder. And it's like, just because of a plane trip, now I have a disease. It just doesn't make a lot of sense.
Yeah, big to agree with both Angie and Dr. Hoge. The other problem is the issue, especially mental health, is far more complex than just a diagnostic. And what we kind of find is that PTSD has become sort of this umbrella term where it encompasses so many different issues and symptoms and negative reactions. But if you look at whether it's a combat veteran or any sort of veteran, it might be diagnosed as PTS, but there could be a broad spectrum of issues going on. So if you look at sort of the research, there's a huge overlap of veterans that have childhood trauma, and whether that brings them into the military or there's that correlation, but that is another factor. There's a lot of veterans that sustain head trauma because of concussive force, which also factors into the things that they're experiencing afterwards. No matter what, in that lifestyle, one, you're being indoctrinated to think in a very soldier capacity, which is different from a civilian capacity. But two, you're put in these stressful situations, which not only has the psychological issues, but it has a full body physiological, including effects on your brain, depending on what you're exposed to, depending on these heightened levels of stress. And so it is very common for people to have these effects that are similar. And so it's the therapists, what is kind of emerging, and from this film you can see that, is instead of just being so dogmatic about the diagnostic, it's getting to know the person and understanding where they're coming from, what symptoms they're having from the ground up, as opposed to a top-down system.
Let's talk about treatments, Dr. Hoge. The question was about treatment.
Well, just to piggyback on what Jesse just said, understanding that the complexity of what people experience, and the fact that it's, there might be a diagnostic label of PTSD or PTS, but the reality is that folks are, they may have had dysregulated sleep cycles for months in the combat zone, and that's not going to reset when they come back. So dysregulated sleep leads to a lot of other health problems. They've been carrying heavy loads, so there's this wear and tear on the body, and then there's environmental factors that they're exposed to and so forth. And so there's a lot of physiological, physical, and medical problems that compound and coexist with the mental health problems. Within the mental health sphere, there are clearly good treatments for these conditions, but oftentimes you have to take a multidisciplinary approach and be able to, address the sleep, try to address maybe the pain or the musculoskeletal, injuries, as well as, trying to help people to reset their physiology so that they can sleep a little bit better, and so that they're not so, not so reactive when they come home, if they have PTSD. So there are very good treatments. There's both psychological and medications. Medications have a role in the treatment of PTSD and depression. I think that, that there are clearly certain medications that maybe have more, certainly more efficacy and safety than others. And there's also, I think, a lot of misconceptions about treatment of these conditions. So I think a lot of folks in the civilian community, springboarding off of this film, I think there are a lot of clinicians who still believe that benzodiazepines are an effective, treatment for PTSD. And in fact, we know from a lot of years of experience that in most cases, it just makes people worse. So benzodiazepines are actually not recommended in the VA and DoD, clinical guidelines for the treatment of PTSD. And which is, but that, that when the war started, that wasn't the case. That I think that was just added to the recommendations, probably starting around 2010, if I'm not mistaken.
Yeah, I want to add something about benzos in particular. Last 2019, I did the VFW SVA fellowship, and I took polypharmacy as my issue. The VFW said, it's too broad. You need to, pare it down. So I focused on benzos, and I pulled this right before we started, but it basically says in fiscal year 2018, the VA prescribed 1.8 million 30-day prescriptions of benzodiazepines to veterans, many of them combat veterans, totaling over 95 billion pills. That is not a small number. That's from fiscal year 2018. And what I learned about benzos was it makes post-traumatic stress worse, and it heightens your risk of suicide 2.5 times higher than a veteran not exposed to benzos. So I know many veterans just in my own city that are on them, and that prescribers continue to prescribe them. And there's not really an evidence-based approach to take people off. The VA does have a protocol. It's not very evidence-based. It's to clinical judgment probably or something, but I can just tell you that I was taken off them the wrong way. I almost died. I didn't shower standing up for 2 years because of it. And as someone is hinting in the question and answer, I do wonder how many of my brothers and sisters have succumbed to suicide because of benzo prescription. I'm thinking it was them, but it's like a pharmaceutical injury to your nervous system on top of your trauma.
Did I hear in the so is lorazepam, is that a benzo?
Yeah, benzos would be lorazepam, clonazepam, diazepam, alprazolam, which is Valium, Xanax, Ativan, and Clonopin, most common. Temazepam is another one. Versed is another one.
Mm-hmm. Yeah. Well, let's touch on the alternative therapies. Jesse, can you talk about your experience transitioning home and what led you to psychedelic therapies and the founding of your Heroic Hearts project?
Yeah, absolutely. And, I again agree with Dr. Hoge. There's a time and place for all of this medication, and especially if you're working with a physician that knows what they're doing and is actually understanding of your symptoms. So, what we are working for is just more tools, more understanding. Everybody's different. Trauma's all different. So we clearly need more tools, because if you look at the last 20 years in terms of the mental health crisis, suicide epidemic, what has been done is not working. That's pretty clear. So my own journey, I was Army Ranger, a few deployments to Afghanistan. When I got out, I had some of the similar symptoms as a lot of other people in terms of severe anxiety, depression, PTSD, alcoholism, all sorts of different issues, putting myself in extremely risky situations just out of challenge of life itself. I went to the VA and had a similar sort of lackluster experience where they essentially said they couldn't help me unless I went on a medical protocol. But because I was still high performing in my professional life, I tried to avoid that as long as possible. And they essentially said there's only limited that they could help me in that case. So that put me in the situation to find my own answers, because I knew the path I was on was going to end up in a pretty bad situation at some point, and the red flags were all there. I came from a situation where I never had any experience or interest in psychedelics, but I was at that rope's end. And so I sort of took a leap of faith and followed my gut and found psychedelic therapies. The one I first found was ayahuasca, and I was like, what am I doing? This is crazy. But I heard all these anecdotal stories, and it did have a profound impact on my life. And so I looked more into it and saw that there's early research behind it, still not to the point of like FDA clinical trials, but enough there to where I could see why from my first hand experience and these other stories that I kept hearing. And so I started Heroic Hearts Project just sort of out of that obligation that at least people, if they get to the rope's end, similar to myself, or they fall through the cracks of the VA, which is a huge population at this point, they at least have some sort of glimmer of hope, other tools. And so we established this organization to provide containers of support. There's already thousands of veterans going to psychedelic therapies or using psychedelics for this purpose, but there's not a lot of guidelines. There's not a lot of people they can talk to make it safer and harm reduce. And so that's where we come in of this is an emerging sort of mental health potential option, and all the research is pointing to that direction. So it's still not FDA approved, but the research is getting there very quickly. And so, I mean, in terms of the VA, it's still a long way, but the biggest ones that are on the cusp are MDMA, which is in third stage clinical trials, almost near the last, and they've had about high 60% effective rate on treatment-resistant PTSD, so the hardest cases, and they've had complete recidivism in about, I think, 68%. And then Psilocybin for depression, which is in second stage clinical trials, so it's still a few years out of the way. But all of these are coming through the clinical trials right now because that's the pathway they have to go. And so it is exciting in this world where these substances are showing some hope, some glimmer, and hopefully also reveal a little bit more understanding about trauma, about mental health, that can open up the doors for other tools as well. And like I said at the beginning, this is about more tools, not less tools. And so in my mind, it's been a tragedy that research has been restricted on these very effective modalities purely because of fear and stigma.
Thank you. Angie, I wanted to ask you to talk a little bit more like on the other side of all this. How are things going for you now? And also let us know about the status of this film, when it's expected to be fully released, and where you're at with that.
So I'm 5.5 years off of all medication, not by choice. It just kind of happened that way. I don't really think I had it in my mind that I would come off of everything. I was trying to take like a harm reduction approach, but I suffer from now what's classified as an acquired brain injury. I did treatment for brain injury for like 18 months, but it's like neurotoxicity from the amount of psychiatric drugs I was given. And I know that's radical and hard to believe, but that's just what happened. I don't know. So I'm like still fighting to get my life back. I suffer from a lot of vestibular issues. I have permanent visual changes that have never reversed, that I never had until I came off of the drug. It's just been a really hard time. We've done 150 screenings just like this one. So I get to talk about this stuff all over the world. We've done screenings in Spain, UK, Mexico, all over. It's happening to a lot of places, that people have a normal thing that happens in their life. It's situational. It's a divorce. Somebody in their family dies. It could be a teenager going through, trying to find themselves, whatever it may be. And it's just like the same repeating pattern that it's pathologized, that what they're having is not normal. And, That's debatable in a lot of cases. And then they're put on a series of drugs. And then 10 years, 20 years, 30 years later, they're like, oh my God, what's going on? Why don't I feel good? I should be feeling better. And then they want to come off. And I've learned so much through this that there's just the medical establishment has basically left patients on their own to figure out how to get off psychiatric drugs, which is really sad and scary. And me having to find the answer online and having to Google things. And like, I never thought that was a possibility, you know, and me having a psychology degree, I have a bachelor's of science in psychology and a master in social work. This isn't talked about. Psychiatric drug withdrawal is not mentioned. Patients aren't given informed consent. I really like to get into that, just about what people are told, what they're not told. So really what I do now is I talk to lots of patients. I talk to doctors. I do interviews on Facebook Live all the time with different experts or people with lived experience, just trying to talk about these issues more and talk about alternatives and like, what does mental health really mean? You know, how can we empower people to learn health literacy, to get informed consent, to ask the right questions, to read the packet that comes with their drug, to talk to their pharmacist, just all these like really basic things that if somebody wants to go on a drug, that is totally their choice, you know, their life, just do so with information. Oh, and next steps for the film. So the film right now, we're doing community screenings, which this is one of them. We also have an educational distributor. So the film is being sold to universities and libraries. And then, so if somebody wants to do a screening, they just email us and we can create a screening, but we'll also be on PBS in January. So we have the potential to go on to 330 different stations in the United States. And we're working really hard right now getting the sponsorship for that.
That's great. Yeah, I think that I've always thought of pharmaceutical industries along with the chemical industry and, you know, it's just part of this complex that's driven by profits and not by caring. Somebody said something in the chat about, you know, universal health care and there was one question that came in regarding combat vets. Do we know what the percentage of combat vets is who are, the percentage of combat vets who are on meds? Has that been answered?
No, but I don't think the VA doesn't know. Like when I did my fellowship, I tried to get, you know, how many drugs are like post 9/11 vets on, and there's some studies about like polypharmacy among post 9/11 veterans with combat experience, but very small studies within VA. It's really hard to get data about the use of psychiatric drugs and how much, and you know, all that. They're not really keeping track, which is also scary.
Mm-hmm. And I wanted to ask Dr. Hoge, you've been in the, you know, VA, you served in the VA for a very long time and at Walter Reed. And what have you seen changing, and have you seen that establishment open to, you know, more change in terms of maybe utilizing some alternative therapies? I know my husband was getting treatment there. Well, he was part of he went to a local free acupuncture clinic as a way to treat some physical problems, but acupuncture can also, I think, be helpful for PTS. So what are your thoughts about that?
Yeah, so I mean, one of the little glimmers of hope, I guess, or positive, you know, positive direction of the care that's provided was the most recent clinical practice guideline for PTSD actually prioritized psychotherapy over medication. So the number one recommendation is that folks who have, you know, combat related or have PTSD, military related PTSD, that they've, you know, if they're in the military or veterans, they're receiving treatment in DOD or veteran facilities, that if they have a diagnosis of PTSD, that the first line treatment is psychotherapy. And there's a number of different options that are available. There's, you know, at least 5 or 6 or more different treatments that have. So, and treatments I think that treatments need to be individualized. I don't think that there's, you know, one treatment that works for everyone. Clearly not. And So that was a very positive shift in the direction of the guidance that was given. There's also a strong emphasis now on complementary and alternative modalities and integrated medicine modalities, where, you know, recognition that you have to have more than just the traditional medical care processes. So, you know, whatever those involve, that may involve, you know, service dogs or equine therapy, or, you know, within the medical establishments, yoga and acupuncture are pretty routine now within, you know, traditional medical settings. So those are, you know, those are all very helpful adjunctive treatments.
Yeah, and there are some great advocates. You know, there are some great people within the VA that are really pushing for this. We get reached out to them all the time that really want that change. You know, they're trying to push that in whatever form it comes. And so, you know, Dr. Rachel Yehuda has been a huge advocate in the Bronx VA, and is actually creating a center there to really push for increased access to MDMA therapy once it's passes FDA trials. And you know, there's more pushes for ketamine-assisted psychotherapy. So there is movement. It's just the VA is a huge organization, so it can be slow, and it can be hard to have the same options at every single VA outlet. But there are growing means and modalities, even within the psychotherapy. EMDR has been helpful. Some brain stimulation has been helpful. Acupuncture, all these things are starting to emerge. So it is at least somewhat of an exciting time in mental health that there does seem to be a light at the end of the tunnel.
And can I piggyback off that really quick? Just that through this process, I learned that I can't really like give my body to someone and have them heal me. You know what I mean? Like, I had to take the control of my health back and find out what works for me and what do I need and what are my goals. And so I think I was talking to Dr. Hoge about this yesterday, kind of like that disempowering of a veteran. Like, when we come home, you know, you're broken, you're sick, here's your disability check, go to the doctor, they'll take care of you. And then you get kind of caught in the system, and you go and you listen to your doctor, and you take what your medications are, and there's really not any questions asked. There's not a lot of critical thinking. I mean, it felt like my whole life revolved around being a patient, you know, like picking my scripts up, telling a therapist what was wrong with me, telling the doctor what was wrong with me, losing friendships, losing social connection. So like coming off of everything and kind of waking up from all this has been like a empowering process for myself. You know, I had a diet, exercise. I do use the whole health program through VA. So I do like a nutrition coach, physical therapy, stuff like that. So I really just think we have to empower people, not just veterans, you know, to like take their health back into their own hands, and don't necessarily like look to an authority to assume that they know what's best for you, because really nobody does. It's kind of a personal journey.
Yeah, that's a very good point. I tell my mom that all the time. She's 85 and she sees a lot of doctors, and I'm like, Mom, you're the expert on your own body, you know. And we've also gotten a message. I don't know if any of the panelists would want to speak to this, but I know that in the Veterans for Peace community, somebody said in a plenary we had this morning, it was Triste Ordeck said, healing, her way of healing is through action. So realizing that, you know, your PTSD, especially if it's related to moral injury, you know, and feelings of being betrayed, and just feeling about I don't know, the wrongness of war or something, that trying to make that like activating in order to change the politics or whatever you think needs to be done, or even activating to help other veterans. I know you all are veterans advocates for sure. And I think that's a really important form of therapy, you know, helping your fellow veterans.
Yeah. Becky, every time
the message that self-care is really super important.
Becky, every time you talk, there's a beeping. Do you know what that is? It's just when you talk, it's really strange. I don't know. It's like a really loud beeping.
I would say it was my air conditioner, but I turned that off because I knew that there was an issue with that. So I'm not sure what it is.
Okay. So yeah, for me, definitely activism. This is my this is my social work. This is what I do, is I talk about these issues and try to help. It does feel like I wish I could talk about it before people get in the mental health system, but unfortunately I'm like on the end where people are hurt and we have to help them when they're hurt. But yes, I've found enormous healing in my VFW fellowship, my role in Student Veterans of America as a chapter leader for 11 years. It's part of my healing. I can't live without helping others. I really can't.
I think like the commonality, the reason why a lot of people join and the word serve their country is because there's that inherent nature in military and veterans. There's that archetype that they're willing to put themselves in these situations for the sake of others. And that only gets fortified when they're surrounded by their brothers and sisters in the service. And so what we see, in addition to the diagnosed issues like PTS, are that veterans are struggling with that sense of purpose, because oftentimes the jobs they find post-military just don't have that. If they go into that corporate job or they go into that, whatever they find, it's just they're working 50, 60 hours a week and, maybe saving a company a few cents every week, but there's just not that same sort of connection to doing something at a much higher level, which I think just adds and magnifies to the issues that they're already struggling with. And so what we often advise and what we often see is that, similar to Angie, when people get that sort of baseline stability, when they are able to help themselves first, what they often turn to is then helping others, which then enhances their own therapy, because then they can, get back to that sort of serving nature. But then they can also see in themselves some of these issues that their buddies are going through. And so it does have sort of this compiling effect. At the end of the day, we're a very connected demographic. We are a community. Anytime you see veterans come back together, it's just picking up where they left off, even if they don't know each other. And so the trick is to enforce that, encourage that, and provide the containers so that that can happen naturally.
Yeah, and that was actually illustrated fairly well in this movie with the veterans gathering and the support they were all giving each other, and also the couple where he was helping her get off drugs. Dr. Hoge, do you have anything else to add? Any general reflections you'd like to share?
No, nothing. I mean, nothing leaping to mind. I think that I really enjoy the conversation, and I think we're all in agreement. Whether it's veteran advocates in the community or healthcare professionals working with veterans, I think everyone is trying to do the right thing and help navigate these complexities in a way that's helpful. But there's obviously a lot of times when people slip through the cracks, or they don't get the right treatment, or they get frustrated. They go in and try to get care. I think one of the big problems is that oftentimes folks, they might be reluctant to get care in the beginning because of stigma or other barriers. Then they go in and get care, and they don't necessarily have an encounter that encourages them to come back to care for one reason or another. They may feel like they're being judged or misunderstood. And I think, there's more and more awareness of mental health problems in the military now than there ever was in the past. There's more and more acceptance of mental health problems. There's more and more acceptance of people needing to get the care. And I think there's also, vastly improved treatments compared to at the beginning of the war, what's available now. As Jesse and Angie have mentioned, I mean, there's so many different therapies, there's different complementary and modalities that are available. So, but there's always more that needs to be done. And
yeah, I still hear people criticizing the VA that they don't do enough when soldiers come home. Like there's not enough support at the beginning of their journey home. You know what I'm saying?
That's an ongoing, criticism. That's a given criticism.
But I always say, if you wait on the VA to cure you, you're going to die first. That's your job. don't blame it on the VA. You know what I mean? It's up to us.
Angie, I don't know if you've been watching the Q&A. There's a couple specific questions at the end about substances. One person asked if there are any programs using Ibogaine to get off the drug.
I saw that. I don't know. I just want to express my caution here that I know there's some research that, and there's actually some organizations that will not do psychedelic therapies with veterans who are not medication naive. And maybe Jesse can speak to that a little bit more, but I just want to urge, informed consent, not only for psychiatric drugs, but also for psychedelics, that there's risks and benefits and alternatives for everything on this planet. So before you try that, it would not be fair of me to not say that, to be careful that, we don't know what's going to happen to a brain that's been on 13 drugs and then you go and take, MDMA or ketamine or whatever. And that's not coming from a place of stigma. It's coming from a place of experience because I've seen it happen and it's very scary and can lead to worse outcomes. So I'll let Jesse take it from there, but just to be careful.
Yeah, I mean, the words of caution are definitely wise with all of these. And you have to understand, especially something like Ibogaine is a very powerful psychedelic. So it's not to be taken lightly. And especially Ibogaine, you really have to go to a trusted clinic because it is much more body and brain intense than a lot of the other ones. And so you'll actually get strapped up to a heart monitor, all that kind of stuff. That being said, there are veterans using it. There is anecdotal evidence, at least in some early research around it being helpful for PTSD and traumatic brain injury, but it's still very early. And so there are some organizations, but it tends to be mostly special ops right now. As with any psychedelic, there's a lot of contraindications. And so what we do, like I said, in terms of harm reduction, is really one, seeing where the person's at in their mental health journey, two, seeing what sort of pharmacological drugs that they're on, and health conditions, because even psilocybin or something like that, you can't take it when you're on SSRIs, or you really shouldn't, because it can cause a lot of other issues. And this is the same with other medications. And so it's not like you just go in there and then it's going to cure everything. And that's what I also said about like stability. Like these are if somebody's already very unstable, then a strong hallucinogenic is not necessarily going to help them. They need to have some level of stability. And so having people that actually know what they're doing, and psychedelics is emerging, so you want to be extremely cautious and knowledgeable. We have a lot of good information on our website, but don't just jump straight into it. The other thing I'll say about it is it's also what you need to be cautious. This is kind of the common phrase, set and setting. So it's not like with me being an advocate for psychedelic offerings, it's not I'm saying go, find the first psychedelic and go do it, because then that can potentially be harmful. People spend a lot of time and energy making sure they're safe spots. They have trained practitioners, that they know what they're doing in terms of dosage, where the person's at. There's a lot that goes into this. It's not like anything else. There's no magic pills in this game. It's all about working with people who know what they're doing and being informed yourself, similar to what Angie has been saying. So there is caution with any of these things. You're not going to just magically walk away. And with psychedelic work, it is a lot of work. It's not just going there and it's solving your problems. It's preparation, it's integration, it's post-integration as well. It can show you issues, it can help you relieve some trauma, but you still have to make the hard decisions. You still have to have discipline afterwards. If you don't change your life, have a better diet, get away from alcohol, drugs, then it's going to be limited of effect. So at the end of the day, a lot of this is the work you put into it on this.
I don't know if you see the message. There's a message in the chat specifically about cannabis, which I know a lot of veterans who self-medicate with cannabis. And
I do want to say something about cannabis. Now, this is just from my experience, because I literally talked to like hundreds and thousands of people in the last 5 years about these issues. But what I'm seeing a lot of is the cannabis that you and I had access to in high school is not the cannabis of today. And that's also different from medical cannabis. So in other words, like it was like 4% THC and now it's like 40%. So I see a lot of people, including someone in my own family, who, when you get it from the street, you don't know what you're getting, and then it can cause psychosis. It can cause a drug-induced psychosis. And then the person is labeled with the delusional disorder, schizophrenia, whatever, and then they're put on antipsychotics. And I see it so much. Colorado is having like a really hard time about this right now with teenagers, because people get a medical cannabis card and then they sell it to teenagers. The teenager smokes it. It's too strong for them. They go into a psychotic break. Then they're diagnosed with schizophrenia. They enter the mental health care system and it becomes chronic. So I just want to say about all these substances, it doesn't matter if it's a prescription drug, a psychedelic, cannabis, whatever. Like I just don't think we understand the brain as much as we think we do. And we need to be humble and cautious. And this is your body and your mind. And once you lose it, it's really hard to get it back, because I'm still working through it. So just really be careful, informed consent. That's all I can say about that.
And again, yeah, reiterate that. But also, if you're looking, cannabis can be helpful, can be therapeutic. But again, you want to find ways of doing it. It's not just about taking it and then you're gonna, be cured. It's about knowing the percentages, the balance of the different strains. How are you going to do it? It can very easily lends itself to self-medicating, and where you almost become habitually dependent on it because of the symptoms. There are ways of using it effectively in a positive manner, but again, you have to be disciplined. You have to look into it. It's not just a question about going to and get the highest, THC and then you're all good. Similar to what Angie said, there's pluses and benefits, and so just be informed. That's how you can make the best decisions. And there's a lot of, fortunately, now with these being talked about, there are people who are cannabis therapists who do talk about protocols that are effective.
And one thing I want to back up a step, just, it feels like the conversation is kind of going toward, we're looking for a substance to fix me. And just that, there's a problem with that. Where did we, you know what I'm saying? Like, I know people have been taking drugs for millennia. We're always looking for something. It's a ritual. It's welcoming home in native cultures. There's all kinds of, history behind that. But when you have an uncomfortable emotion and it's too big for you to handle, why is that first impulse to find something to take it away? That's kind of what I want to know, and that we need to back up a step, like before diagnosis, before, a tragedy, before you're in crisis. Why aren't we learning? Like, in war, I know we don't talk about, like, you could die today, and we all experience that. And it's like so present that I'm doing harm to others and I could lose my own life and never see my family again. And that's too big to handle. And we don't talk about it because you can't in a war zone, because then you can't function if you really, talked about the gravity of the situation. And then we just leave service and we still don't know how to handle those emotions. So I just want to implore everyone to back up a step before you go looking for a substance. Like, figure out, like, okay, what is going on with me? What are these feelings? How can I work with them? How can I be less afraid of them? Because I know I've had to work on that myself. Like, yeah, grief is heavy and I can't run away from it. And there's no pill to take and there's no magic potion. And here it is. And I'm just going to have to feel it and talk to my friends about it and get through it, and maybe that means seek help or whatever help you need, but just back up a step to not always look for a substance to take away how you're feeling.
Yeah, thank you for that. There's a lot, not just in war and veterans experiences, but in everyday life, there's a lot of stressors and a lot of emotions that people, or responses that people have that are normal.
Dr. Hoge, you look like you want to say something about this.
Well, I really appreciate you're essentially making a process observation that here we just watched a film about the dangers of pharmacotherapy, and then the discussion is kind of, we've meandered a bit in the discussion, but there's a fair amount of questions about cannabis or other psychedelics or other types of substances. And I just, I agree with you. And I think that one of the things that Jesse also mentioned early on was that we need really good quality research. And I think there's a lot of passionate advocates out there, passionately believe what they believe, that cannabis helped them with their PTSD or whatever. But when you really look at the evidence is really pretty limited and actually suggests that harms outweigh benefits with cannabis. But I hesitate to say that in a forum like this, because there's a lot of people who will shoot me down and say, no, well, that's not what the evidence shows, and they'll argue with me till the cows come home. But but that's what the evidence shows. If you really when you're really talking about a well-controlled randomized clinical trial, the thing that's going on now in the psychedelic arena is that there are really well-controlled randomized trials. So there was one that came out recently on psilocybin versus an SSRI for depression, and it actually showed no difference. Well, that's not what the psilocybin advocates are going to, that doesn't necessarily, there are going to be people who are going to argue with the quality of that study and so forth, but that's what it showed. The depression, the recovery from depression was comparable in both groups. Okay, so it did help, but it helped not necessarily that much better than the SSRI. And then the MDMA trial that's come out recently showed that it did, in fact, distinguish itself as with a significant improvement compared to the control condition. Also published in a very high quality journal, very well controlled trial. As well as you can control these types of trials. There are issues with that because you can't really double blind with a psychedelic substance. So you have some issues of bias with that. But, the trial was very successful. The problem with it, of course, is that it required 40 hours of treatment. So when you start to talk about, what's the availability of this in a setting where, they're going to be using it according to the indication, if the FDA comes out and gives it an indication, it's going to be many years before it's available to the degree that people may want it to be available, because it requires a lot of hours of therapy in addition to the MDMA administration. But that's the research that needs to be done. So I don't think we should latch on to one or another thing. These are important conversations to have.
Oh, Becky, you're on mute. Also, Becky, I think Jesse has to go soon, so maybe we should wrap up.
Yeah, I was just looking at the wrap-up script here. We're way over time, but that's okay, because we're the last program on the schedule, and we could go as long as we want. But I know we're all also busy people. So I want to just give everybody a minute, however much time they want to take, to give us any closing thoughts you might have, and to plug your work, your websites, whatever else you might what other resources you might share. Go ahead, Angie. Or maybe you should be the last.
I'll be last. I'll go last.
Okay.
Yeah. Jesse, go first so he can go.
So if you guys want to learn more, we keep up with the research on psychedelics, heroicheartsproject.org. We're on all social media, Heroic Hearts Project. We're a 501c3, so if it's of interest, that's how we are able to connect and help veterans. So any support is helpful. But yeah, our website has a lot of great information, and I think we're all on the same plane here. As more tools are better, and let's approach these with respect and the appropriate preparation. But thanks, everybody. This has been great. Appreciate being here.
Thanks, Jesse.
Yeah, and I don't have anything to plug. I mean, I did write a self-help book for combat veterans called Once a Warrior, Always a Warrior. It needs to be updated because it doesn't have any information about psychedelics and other treatment. I mean, since I wrote that book, I became an EMDR practitioner. I do a lot of EMDR therapy. I think it's fantastic. It's another tool in toolkit. So there are things that I'd like to add to that book, but it's out there. It's available.
It's really good. I read it myself, so go get it if you can. And I'm Angie. You can find us on Facebook, Instagram, Twitter. We post articles every day on subjects like this. We have a YouTube channel with over probably 200 videos and clips that didn't make it into the film. supplemental material. We do interviews every single week on Facebook. Just stay in touch with us. Visit our website. Our website has all the research from the film. We have a reading list. We have resources and alternatives listed on our website. There's so much good information. And we always say, like, don't believe anything that you saw in the film. We want this to be like the beginning of your own journey. Go do your own research, learn about the drugs you may be taking or your loved ones, and make better informed decisions in your own mental health. So thank you so much. Our website is medicatingnormal.com.
And I want to thank you again for bringing the film to our attention and to our viewership.
Thank you, Becky, for rooting for us and getting us into the convention. It just, this was a proud moment for me to be able to screen it with veterans.
Yeah, you said this was the biggest veteran audience you've had in all your screenings?
Yeah, I've done like small like vet centers and stuff and Air Force bases, but not, a public. I get a lot of no's from the veteran community, believe it or not. I think, there's some pushback going on, but so I appreciate you all welcoming us.
All right. Thanks again.